Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
But first, MPs have warned that vulnerable patients could be at risk because of demands for efficiency savings on care that's provided outside hospital. NHS continuing healthcare funding is for patients who need more than social care, such as washing and dressing. But the Public Accounts Committee says in a report today that some patients are not told they're eligible and some have died before the money came through. Our health and social care correspondent, Victoria MacDonald, has been to meet the daughter of one elderly patient who tried to fight the system.
She cared about everybody. She was a nurse for many years. If anybody wanted anything done, they would ask my mum to do it.
Betty Wilson died last October. In her final 3 months, her daughter Carolyn Bailey tried and failed to get funding to pay for her mother's care outside hospital. The 83-year-old had vascular dementia and Alzheimer's, and towards the end was incontinent, confused, having difficulty swallowing and needed help to walk.
Amongst the fighting with the NHS, I was having to deal with the deterioration of my mum and supporting her, visiting her every day when she was in, when she was in hospital and then when she went to the nursing home. So, and coping with the emotion of her deteriorating and then finally losing her. These were the publications that I needed.
Mrs. Bailey had applied for a continuing healthcare or CHC package.
And this is the checklist.
That's the checklist
that you had to fight for.
We had to fight tooth and nail for that, and
it's for a patient with significant or primary health care rather than social care needs. So the NHS, rather than the family, pays. Now, a report from the Public Accounts Committee has found the system is failing vulnerable people with complex needs, the elderly and those with disabilities, just at the time they most need help.
When committee members were taking evidence in this room behind me, they heard from families who had not even been told about this funding. They also heard about a postcode lottery where you are more likely to get the money in one part of the country than in another. And they were also told about long delays, so that in some cases the patient had already died before a decision was made.
Clinical commissioning groups, or CCGs, decide on the funding, but they've been told by NHS England to save money, and MPs are afraid that this will affect care.
What we need to see from NHS England when they pass on these efficiency savings to clinical commissioning groups is how they're going to make these efficiency savings without impacting on patient care and without changing the thresholds for assessments, because it's over £800 million worth of efficiency savings.
NHS England and the Department of Health and Social Care said funding is set to increase, though they do plan to make the process clearer.
My biggest issue in my mum's case, pure and simply, is that she was at end of life. We told them that we thought she was at end of life. We told them that she had rapidly deteriorated. There was no doubt about it. They themselves admit that if someone is at end of life, you should be fast-tracked.
Need for pain relief increasing, confusion increasing, language difficulty.
6 weeks after her assessment for the funding, Mrs. Bailey's mother died. West Hampshire CCG said any decision is based on a person's healthcare needs rather than their diagnosis, and everyone who is eligible is funded. Mrs. Bailey has now appealed.
Victoria MacDonald.